An interesting case here. We're posing the question. Pelvic asymmetry, which this client perceives in standing and walking, is it because the pelvis is asymmetrical? Or is it because of a sacroiliac problem? Or could the shoulder girdle be the cause? Again, the client complains of lasting pelvic asymmetry, has had extensive care over the past year, lots of expensive care, multiple consults, which we won't elaborate on, and her main complaint is this sense of her pelvis being asymmetrical, enhancing pain and discomfort. And she wonders, is it because the pelvis is asymmetrical? Is it because of the sacroiliac joint? And I'm suggesting, well, maybe the shoulder is contributory. So we're going to have her walk and describe how she feels. And I am Jerry Hesch with the Hesch Institute in Henderson, Nevada, very close to Las Vegas. Our website is www.heschinstitute, that's spelled H-E-S, like Sam, C-H Institute. And we do consultation treatment, and we also do instructional seminars and distance learning for hands-on clinicians. So I'm going to call this client Susie. It's not a real name, but Susie, would you come out and walk and just give us just tell us how you feel walking, please?
I feel like my right shoulder is stuck.
Okay, now you didn't feel that before. When you walked around the block, you went and took a 10-minute walk and you came in the door and you did not say, I feel like my shoulder's stuck. What did you tell me?
That my left pelvis was back and my right pelvis felt forward.
Right, and that's all you were aware of, am I correct?
At that point, yes.
Okay, so then I screened you and I pointed out to you that your pelvis moved in every single direction that I could make it move in passively. And I had you get up in child pose position, and I did spring testing there. I had you lay on your back, I had you lay on your side, I had you lay on your stomach and your other side. I had you sit and bend forward, sit and bend backwards, and I checked the hip joint in every single motion in multiple contexts, and I then looked at your shoulder in standing. I looked at you in standing, and I saw that shoulder. And I saw that right shoulder girdle being very elevated and anterior. And so I had you lay down and I took a look at your shoulder. And rather than reproduce all the spring tests on the pelvis, because those are available on other films that I've done, stop right there. And let me see your back. Just stand symmetrically. So you can see that right shoulder girdle is elevated. Go ahead and walk, please. And just relax your arms. Just let your arms do whatever they want when you walk. Good, come on back. There's some left arm swing, but there's no right arm swing. Come on your back, please. Actually, stand and face me. Turn around and face me. I'm not going to capture your face, but I am going to capture the shoulder girdle, and you can see that the right shoulder girdle is in fact elevated, and you might be able to tell that it's rolled in, that it's protracted. It's very obvious to me. Anyway, come lie on your back, please. The left acromioclavicular joint joins the scapula, has good mobility when I do a very general spring test. Okay? On the right side, when I do a very general spring test, I can't load it. I can hardly load it, and I'm tripling the amount of force. What does it feel like to you when I do what I'm doing?
Very, very tight. Very tight.
How does it compare to the left side? How does the left side feel when I do the same thing?
Very loose.
How much force am I doing on the left?
Not as much.
Not as much. Okay. So what I want to do is treat you while I point this video camera at the skeletal model. So we're trying to enhance mobility in this region, which is where the shoulder blade joins. This is the acromion part of the scapula, where it joins the clavicle, okay? And the true shoulder joint is down here, okay? We're treating the shoulder girdle as the scapula relates to the clavicle, and I'm going to do a 30-second release on that. I'll spend more time after we do the filming, but I just want to do the quickest release. I'm going to teach you how to keep this released. Basically, I'm tractioning the joint and distracting the joint. I'm engaging the type 3 mechanoreceptors that go to the ligaments and the joint capsule, and I'm engaging the receptors in the tendons that are very similar. They're Golgi tendon organs, that's the name of it, inside the tendons. And inside the ligaments, they're very similar receptors. They just happen to be in ligaments. So that was my 30-second treatment. And I'm going to, of course, have to teach you how to keep that. So let me get the camera. Let's see if we accomplished anything. And how many different doctors and therapists have you seen for this problem?
For the shoulder problem, I've only seen...
No, not the shoulder. Your main complaint is your pelvis.
Oh, my pelvis. I have seen maybe 30 total.
30 different practitioners.
Yes.
Out of pocket?
Some.
Out of pocket, how much do you think you've spent? This is in the last 10 months.
The last 10 months.
How's your shoulder moving?
Much better now.
I can load it very freely and I can spring it. Just take a crazy guess what you think you've spent. Come out and walk, please.
Out of pocket, probably about 15,000.
15.
15,000?
Yeah.
And then the insurance, of course.
Yeah.
Now, I have done a lot of work on your hip and on your pelvis, so there's no denying that. It's just that at this phase of treatment, and go ahead and stop. At this phase of treatment, this is the part where I focus on the rest of the body. And look straight ahead, please. Okay? So that shoulder is no longer elevated to the degree it was before. Go ahead and turn around, please.
That's true.
Yeah, so Manny just said that's true.
Yeah,
Good.
that was way off.
Good. So walk again, please, and tell me what you experience.
I feel more even all over my body.
So before we did this, your pelvis felt like it was twisted. Like the left was twisted back, and the right felt like it was twisted forward.
Correct.
And the name of the video was Pelvic Asymmetry, Sacroiliac ? Or Shoulder as Cause. Of interest, the injury did also cause pudendal neuralgia, and when her pelvis is more symmetrical, she feels less symptoms inside the pelvis, correct?
Correct.
And so in summary, I would submit that your shoulder contributes to your symptoms of your pelvis being asymmetrical. Now, we did work on your hip joint and we did work on the pelvic movement in multiple planes, and we made improvements in that to you had a distinct subjective improvement.
Correct.
Like when you left yesterday. But as soon as you walk, I don't know how many steps it takes you, but let's just say you walk 1/8 of a mile and then it all comes back.
Correct.
But I laid you on the table and your pelvis moves normally today in every direction. So then I looked deeper, found that shoulder girdle forward, and right now we unlocked the shoulder girdle, and now you feel
Much better.
So in summary, I'm going to suggest that the shoulder girdle is a significant contributor to pelvic asymmetry, which some people interpret as a sacroiliac joint dysfunction, which is not completely accurate, but I'm not going to belabor that point right now. So I'm very pleased that we've isolated the shoulder girdle, and we will teach her how to keep that mobile and how to integrate pelvic girdle with shoulder girdle. Thank you.